Hello, and thank you for joining us. My name is Greg Polito, and I want to welcome you to the SFMA's Safety Committee YouTube channel. Today's safety and health video will be covering COVID-19 key learnings, and it's sponsored by the South Florida Manufacturers Association, and we thank you for tuning in. On behalf of the SFMA's Safety Committee, we hope that you are safe and healthy and are following all of the CDC guidelines. A copy of this video can be found at the SFMA website under Safety Committee. Today's guidance represents the speaker's view on the topic and does not necessarily reflect the views of the SFMA. Any mention of products, commercial entities, or publications does not constitute endorsement by the SFMA. We've simply put together the best practices and lessons learned that others have faced while fighting the COVID-19 epidemic. As information becomes available, we will continue to add content and highlight key areas that all manufacturers can benefit from, and I encourage everyone to ask questions and post them on the comments section below. Your feedback will help us improve our content and provide the necessary resources that you need as a manufacturer to stay in business, protect your workers, and be in compliance with all safety and health regulations. And remember to like, share, comment, and subscribe to our channel. Key learnings, here we come. Facilitating key learnings that you can immediately put into place to minimize pathogen exposure is our goal, specifically addressing the engineering, administrative, and PPE controls that we can adopt quickly to reduce the risk of virus from entering our facilities. And as we discuss these measures and how we can connect with our community leaders to bounce ideas and strategies that can effectively contain and mitigate the spread of the virus in the workplace, and considering how quickly the virus is spreading in the world, in the state of Florida, and specifically locally in the SFMA member region. Make no mistake, fighting the spread of this virus is a very tall order for employers in all of the 8 counties that the SFMA serves. As of Thursday, the Florida Department of Health has reported a spike in cases totaling 24,119 confirmed cases and 686 COVID-related deaths across the state of Florida. Yet, as alarming as these numbers are, according to the Institute for Health Metrics and Evaluation, they have forecasted that Florida still has more than 3 weeks until reaching its peak death per day. And that's assuming full social distancing continues. At least through the end of May, that's what they are projecting. This is a very troubling situation that we have on our hands, but we must do all that we can to ensure that our workers and our families are following CDC guidelines and are taking the necessary precautions to avoid transmission on this highly contagious virus. This is everyone's responsibility, and we must make it a priority to connect with our community leaders if we stand a fighting chance against the virus. We recommend that you explore and take advantage of all of the resources that the SFMA can provide its membership, the industry that it serves, and to the communities in all 8 counties that are fighting the challenges posed by this horrendous virus. Minimizing pathogen exposure using the hierarchy of controls is fundamental for controlling exposures to hazards. It is undoubtedly true that the most effective way to attack a hazard is to eliminate or replace the hazard in its entirety, but to prevent an infectious disease transmission with either option isn't feasible. So we'll cross out the first 2 levels within this hierarchy and forget about it at all. It's possible, however, that a vaccine to counteract the virus will become available in about 18 months, so stay tuned. Next on the list is engineering controls, followed by administrative and personal protective equipment, or PPE controls. These are the areas where we are going to be placing the most emphasis as employers. It's essential that we use our combination of interventions from across all of the hierarchies of controls to protect our workers. One thing most of us already are doing is isolating people from the hazard by putting barriers such as glass or plastic windows in place. I'm sure you've seen this practice a lot in grocery stores and at the financial institutions. Take a look at the image to the right so you can see what I'm talking about. Another control that you can put into place is actually restricting access once inside the facility with either a banner tape, safety cones, and chain links to limit the entry and exit routes, for example. And the last engineering control that you could put into place is ensuring that your ventilator systems are clean and that the air movement and flow direction of your ventilation system is well maintained and the air filtration system in place is adequate. That is very, very important. These are some of the examples of things that you can do with this engineering control level. Before we move to the next slide in our presentation, I want to propose a question to you. Are you ready? Here we go. What kind of engineering controls can you put in place for your CDL drivers who could not be 6 feet apart when sharing a ride with another worker to get to a drop-off or to pick-up location? Anyone have the answer? Two things come to mind. First, you can separate the space in between the driver and passenger by installing a do-it-yourself protective screen or some sort of plastic material like a shower liner, for instance. Or secondly, you can ask the secondary employee to drive a truck behind in either of a company car or personal one to get to and from the pickup points. Now, this last alternative will probably have risks that professionals cringe at because the option does bring other things to ponder upon, like mileage or gas reimbursements or things like that, as well as auto insurance considerations and legal liabilities that you as the employer could be potentially exposed to. Now, I would like to hear your comments, so please, once again, make sure you share. And remember, I'm not endorsing any of these, not one of them. I'm just simply presenting the two different options. And if you have any options, I'll be happy to hear them. Next up is administrative controls. Things like personal hygiene, cleaning and disinfecting, isolation of people, limiting the size of gatherings, and keeping a 6-foot separation. It's a key to halting the spread. I mean, if we could freeze everyone for the next 14 days, we would see the spread of the virus declining. But we don't have a magic wand to be able to do that. Human beings are rarely perfect at following rules, but as business leaders, we must make sure that our employees are following these rules specifically. And if we stand a fighting chance against this virus, it's extremely important. Compliance here is a key to avoiding the COVID-19 to enter our workplace. Let's keep it out. So what can we do? First, we can, for example, require that employees' temperatures be taken prior to entering a building and decline entrance if a fever is detected. Now, keep in mind that the temperature reading should be kept confidential and the person administering the temperature should be trained on this procedure. Now, the measure of it is a bit controversial since there has been COVID cases without fever symptoms. However, during this pandemic, the EEOC has allowed employers to take this measure. Secondly, we could train our employees on how to wash their hands, install additional sanitizing dispensers, and encourage everyone to constantly wash their hands. Next, we can ask the cleaning crew to increase the frequency of their cleaning duties from once or twice a day to 3 or 4 times a day. The more the better, as we are going to talk about the differences between cleaning and disinfecting on the next slide. After that, we can extend possibly and ask employees to work remotely to reduce the number of staff members at the office. And for those that must come in to work, we ask that they stand at least 6 feet away from each other and require that they do not share their work tools or others and wipe down panels such as touchscreens, doorknobs, and everything else that the person uses. Fifth, signage with the new work rules. It serves as a good reminder of the new practices. And of course, lastly, train your staff on all of the measures that is required of them to follow. When we ask the cleaning crew to clean and or disinfect more frequently, it's important that everyone understands what that means. When you ask someone to clean, you're asking them to wipe down the surfaces with soap and water. If you're asking them to disinfect, then that means that after they finish wiping down the area with soap and water, you should use a disinfectant that is EPA registered. You should clean and disinfect frequently all touch surfaces. This includes tables, doorknobs, lights, switches, countertops, handles, desks, phones, keyboards, toilets, faucets, sinks, anything that your hands come in contact with. EPA registered products mean that the disinfectant has successfully passed rigorous testing to verify that it kills germs and viruses. Reading the labels is extremely important. Find proof that it is EPA registered and for each product that you are using. For example, the image on the slide is of a Clorox wipe and it's highlighted in yellow that the EPA registration number is there. So now that you know the difference, make sure that you clean surfaces first with soap and water and then disinfect. You have two teams, one cleaning and one disinfecting. Some companies, as in the food and airline industry, have introduced a fogging process to disinfect the interior of the aircrafts as an added measure to their initial cleaning. They clean first, then fog, this time with table trays lowered and overhead bins and lavatory doors open. Seatback entertainment touchscreens are given an extra cleaning and used disinfectant wipes. Reason being is that fogging is not as effective as active surface cleaning, but is effective as an added measure. Our last control measure deals with personal protective equipment, or PPE, such as gloves, masks, and protective clothing that puts a barrier between the worker and the exposure. This is by far, within the hierarchy of controls, the least effective measure, but it has been a major focus during the COVID-19 pandemic. This is because, similar to administrative controls, PPE can be implemented rather quickly if it's available. Please remember that a risk assessment must be conducted to determine the appropriate PPE requirements at your work site. And as with everything, remember to review the safety data sheet for the cleaning and disinfecting chemicals that you are using. So how do we minimize the pathogen exposures when removing your gloves? The illustrations here are fairly self-explanatory. First, you must grasp the glove near the cuff and pull down until it comes off inside out. Then cup the gloves in the palm of your glove hand and insert a finger of your bare hand inside the cuff of the gloved hand. Pull down so this glove comes off inside out with the first glove tucked inside, and then of course make sure you thoroughly wash your hands. So the big question now is, where do we go from here? The SFMA is the only resource for manufacturers in South Florida, saving its members time and money through advocacy, networking, and resource efforts. As we continue to fight this pandemic, the SFMA wants to ensure that you remain connected to the community leaders and other businesses like yours that have experienced a disruption as a result of this virus. So let's stay connected through this transitional period where we've had to cancel in-person meetings and large-scale events due to our part in stopping the spread of this virus. But remember, you're not alone. Please keep in mind that risks and safety professionals are available throughout the SFMA network to help you navigate through this challenging time. Request a complimentary workplace risk assessment for your business, and remember that this webinar is also available in Spanish. Before you go, don't forget to complete the evaluation survey. And until next time, be safe and be healthy, and have a great day.